It's cold out here still. Yeah, Memorial Day weekend coming. It's like it's just insane. It's never this cold. It's like 70. Chilly. Yeah, wind blowing crazy. All right. This is Walking with Average Joe number 7, I think. I think it's 7. Anyways, so hopefully you guys will watch the video I dropped. It was on the difference, really, to be able to tell the difference between radicular pain, referral pain, and just kind of localized pain. And what to look out for, what some basic treatment techniques you can do. In the last couple of videos, talked about arthritis and the symptoms of that in treatments. Then I talked about herniated disc and their kind of symptoms and what you need to do with them. Then finished up the trio with just some basic referral pain coming from muscles, straining them, and then what can you do to help those, and then how do you differentiate between the three. So, real basic, but it really does, I'm hoping that gives people some ideas, especially if they're worried, having a lot of pain. Hopefully, give them some comfort. Yeah, okay. You don't need to worry too much about it. It's not that bad. It's just average Joe saying that it's this, that, and the other thing. You'll be all right as long as you do the things I say. Getting older stuff for the birds. It's harder and harder to get out and exercise. But I'm walking. That's what you got to do. Getting out there walking with me. Chilly, chilly, chilly. All right, so I did at the end of my video, if you watched the end of it, you saw me put up one of my old videos, Snapping Hip Syndrome. So I think my next several videos are going to be about the hip. Now we'll probably go into hip arthritis, maybe total hip replacement, maybe iliotibial band syndrome, clicking hip syndrome, iliopsoas syndrome, runner hip, all kinds of stuff you can think about the hip. Sacroiliac joint stuff. I don't know the difference between an origin of symptoms coming from the hip versus coming from the back versus coming somewhere else and be systemic. So lots of videos to do over the next, and just in that one area. That's not even talking about, if you want to get crazy with just the mechanics of the hip. Yeah, let's see what happens. Sorry about the wind. I know when the wind, it blows on my mics and my earbuds. It's a terrible noise. Hopefully you guys can ignore that a little bit. So, hopefully y'all gonna have a nice Memorial Day weekend. I gotta work. Someone's gotta work, right? Plus, weather's supposed to suck here anyway. It's supposed to rain all 3-4 days, so anyways. So let's talk about horror stories. Horror stories number 1 on this session. Excuse me. So this happened a lot. I say a lot, but it happened more than once. Let's just say this. When I was an inpatient years ago, down in the neuro suite, post-op surgery, the next day, you're picking them up, getting them out of, trying to evaluate them and at least get an idea of where they are at baseline level for everything. So you're just checking them out. And sometimes you catch things that the physician missed, or maybe things developed after the physician did their evaluation. So this happened, I suspect, because of that. You know, things can rapidly improve or not improve. Hey, how you doing? Things can improve or not improve in the neuro suite when you're in the hospital. And so in this case, it was a person that did have neck surgery. And in that neck surgery, they didn't do so hot. They ended up coding on us, which means is they end up having to do CPR. So here I am, getting them up, trying to get them up. I'm assessing everything, blood pressure, all their vital signs, oxygen, heart rate, EKG. Yeah, it was getting worse. They weren't responding too well. They were very groggy, but I thought it was from the medication. Obviously, it was only partial because of the meds. So then they crashed, and boy, did they ever. So here I am, calling a code, trying to drag them back to the recliner chair and tip them back in the chair, and you know, wouldn't come to, excuse me. You know, doing sternal rubs and everything else to try. Hey, Bonnie Rose. Hi, Bonnie Rose. How are you? I'm doing all right. I'm out here doing my walks. I was just talking about my video that I dropped earlier, kind of going over the three videos, the last three videos I've done over the last couple of weeks, kind of culmination of, you know, lower back symptoms. So let's see how you guys all like that, the difference between referral pain, radicular pain, and local pain, specifically for the lower back. So when I talk about my horror stories in the neuro suite where I used to work years ago. And so this is the one where she finally did come to. You know, I tilted her back, blood pressure started to rebound. She started to come to. Oh, I will watch. Well, thank you. Hopefully it'll help you. Hopefully answer some questions you maybe had or maybe that someone else had. So you can never tell. So, so yeah, that, you know, it's one of the scariest things when someone all of a sudden goes from being able to talk to you to crash on you. And it's their eyes, they just get this, their eyes get this kind of faded away, kind of blank stare. And all of a sudden their eyes literally roll back in the back of their head, and it's game on at that point, which means is you better have done enough training, enough of the, you know, that it's automatic that you don't even think about it. And that is the truth. When you do enough CPR training and coding training, that really is just it's just a reflex. And all of a sudden, you know, you don't even think about it. You're all of a sudden you're doing all the things you're supposed to, checking pulse, checking, you know, if the response, checking if they're breathing, you know, and then doing all the things you're supposed to do, tilt them back, get their blood pressure back, because you get, and see if you can get gravity to help you. Try and get that carotid arteries open in their neck to get some oxygen going through. And she did. She finally came back, but we were talking about someone that just had neck surgery the day before, and you just don't know. Like I said on my last walk, there are so many. It's such a small space in your neck versus the mid or lower back, and you have this. You know, you have all the nerves. You know, you have that go into the brain, that go into the vertebral bodies, go into the joints, and it doesn't take much swelling at all, really, around that area to affect your swallowing, to affect your breathing, to affect your blood pressure. Um, you know, you could have what they call a vasovagal response, and all of a sudden you pass out because of that. I mean, there's a lot of different reasons why when someone has neck surgery and they're the day after and you're seeing them, you know, you know, when people see a physical therapist and you know they're you as the therapist is being observed by a family member or someone who doesn't really have any training, They just think, oh yeah, they just got them up and did this or that and the other thing, and they don't realize all the extra training you have to have when the shit hits the fan, and how you have to not think about it. Has to be a reactional thought process that you've been trained enough. It's embedded enough in you that it just happens, and so it's it's a lot of different things. Whether in that situation, whether it's the basics of um, CPR training or basic life support training, or the higher level education to where you're trying to clear out the neuromotor, you're trying to clear out the uh, the basic anatomy from the surgery could be causing symptoms. You're screening out the internals, and then you're talking to nursing. Hey, what medication did you just give them that could be causing all these symptoms? Why are they crashing? So people, those are all the things that are literally boom, 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 going through your head very fast. That you've been trained so well that you're clearing things out in your head that you don't even think about. But, it's all being kind of like being run on software in the background. It's so instinctual you don't even realize it. That you've already cleared out the nervous system, the vascular system, anatomical systems that could be compromised, causing the symptoms. So, excuse me. Really, I guess sometimes that's the difference between a person who 1 month ago I lost my left leg because of vascular surgery. Oh, wow, I'm sorry. Yikes. That's a botched surgery. I mean, vascular, was it like a vein stripping, or were they having to do a bypass where they had to take from the femoral artery to do the bypass graft for the heart? I mean, what the heck? That's crazy. Is it a is it above the knee or below the knee? We're at what they call a transfemoral, which is above, or transtibial, which is below the knee. So yeah, that sounds like that could be some negligence. That sounds like a medical lawsuit to me. You're going to have vascular surgery and you lose your limb. I mean, unless you have really bad peripheral artery disease, PAD, and only made you sign a waiver. You know. So anyways, that's the horror story that I had where you just go in, it's a typical day, nothing's happened for months and all, and you gotta be on your game. Well, you're not feeling good that day, or maybe you just had a shitty night, or maybe you didn't sleep well and you're coming into work and your normal routine's all thrown off anyways because maybe someone you called out sick and you have to take on their caseload or something like that, or partially. I mean, it's just insane that can happen. And then all of a sudden, that falls in your lap, and you're like, Jesus. It's like, oh man, and then you're just wrecked. The rest of the day, you're freaking wrecked because of that, because that takes you into a hell of a tailspin where, all that adrenaline, and then you have to come down from that adrenaline afterwards. I mean, we're not robots. I mean, there's an emotional roller coaster that happens as well when something like that goes on, or transpires. So yeah, I mean, that's that's one of my horror stories, and you just eh, once it's happened to you once, you don't forget. And, you're thankful. You're thankful for all that training you did all those years, and all the stress you put yourself under during that training. Because for something to become instinctual automatic, it takes a lot of training and it takes a lot of stress for your body to, anytime you want to learn something new or learn something that has to not be a thought process, it takes a lot of stress, it takes a lot of hours. I mean, was it 10,000 hours to become a professional or something? Well, 10,000 hours don't happen overnight. So, So yeah, and you went, oh, they don't get paid, they get paid a lot, or they don't get, it's people always think about those things too. I'm like, yeah, well, because of me with my years of experience, I reacted the correct way because I had the proper training. Because of them, they can't unplug my my oral vascular. Because them can't unplug my oral vascular. Uh, oral usually means mouth. Vascular, I don't really understand because they can't unplug my oral vascular. That isn't. I don't quite understand what you're talking about there. If you could explain a little bit more, I might be illuminated. But uh, so yeah, I mean, there's a cost benefit to everything, right? And the training and the training, there's a cost to that. The stress and the anxiety of going through the training over and over again and being exposed to the years of, of, in this case, being a physical therapist. Everybody thinks you're a massage or you just do exercise or are you an athletic trainer or, there's a lot to be said for that. And, when I went to school, it seems like yesterday, but it was many moons ago now. There was over 300 applicants to the program that year. So it's one of those things where you apply to a program, and in this case, you find out afterwards. And it was 300 people I think it's like 301, 302, something like that, applied to the program the year I got in. And I think it was like 150 or something like that got an interview. And out of that many, 31 actually got in to the program, got accepted to the program. And then after 3 years and 3 months or something like that, the program, 3 years, 4 months, 3 years, 3 months, something like that, 17 of us graduated. So out of 302 applicants, 17 graduated, and I was one of them. So the attrition rate is absolutely insane for physical therapy, and I'm sure it is for a lot of professions. But I don't think I think people give. Don't get me wrong. That the top dog is always the MD. You know, uh, you, you wonder sometimes though. You know whether they're not tactful or you know not all medical doctors got A's in schools. So a lot of them just it's a pass fail thing. I think. I've met a few of them where I was like, where the hell did you get your freaking license out of a Cracker Jack box? Some of these are like holy crap. I mean, I I took a bunch of classes. I went to Mercy College, which is in Dobbsbury, New York, and they had the first several classes like gross anatomy and gross neuro and phys and stuff like that had pre-med students and either physician assistants and their nurse practitioners and stuff like that. And hi, and in that program, yeah, I remember the professor. She actually taught also at Einstein University, which is in New York City, and she taught the gross anatomy to all the medical doctors, and she kind of showed, okay, this is your level of knowledge of gross anatomy, which is we had to dissect the cadaver, we had to do it for gross anatomy, we had to dissect the cadaver for neurophysiology too, which is we had to dissect the heart, the lungs, the whole vascular system, the whole nervous system. We had to know it all literally from head to toe, all the names, and the way I learned it was I drew the whole thing out. I drew out the entire body of the vascular system. That's the arteries and veins, as well as the neural system. So the neuromuscular system. So I drew it all out. So I literally had it, the whole thing as a picture in my head, and that's how I learned it because that is the groundwork for all medical professions, whether you're talking about an MD or an adjunct to the MD, whether it's orthopedics or whether it's they go into doctor of osteopath, or whether they go into orthopedics, or if they go into you know neurology. I mean, the basis of all those professions really are coming from gross anatomy in neurophysiology. So that's the reason why all programs start with that, and it's intense. I mean, you those are make or break classes, which means is you start out with a lot of freaking people, and that by halfway through it, a lot of people have dropped out because they can at least get some of their money back from their tuition. If they, there's kind of like that, 30 days in, 60 days in, where you can recoup some of your money back when you just being made of the right stuff to be able to not. I mean, it isn't that they just can't retain the information or retain it in the detail that they need to, and or take in the information at a certain pace. So you gotta, excuse me, you gotta be able to learn this stuff and just slam it in the brain, and be able to give it back. So you gotta be able, you gotta know how you retain information. Now, whether some people can just retain it verbally, auditorily, or whether they have to write things out and auditorily, or literally, uh, some people have to do all three. I'm pretty decent at just if listening to it. I get a couple hours. I get a couple hours, and then I know I'm done. Anything more than that, I'm not really going to retain too well. But if I draw it out, if I draw out something, don't get me wrong, I can't draw worth shit. But if I can draw things out, how it flows in this regard to like the vascular system or the nervous system, organic chem, where we had to know certain molecules and certain stuff like that, and had to draw the diagram out. That freaking I pick up like nobody's business. I can recite that, recall that, months later. And then also, a combination of association. It's a building block. Boom, 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 and you can relearn that. This message is held for review. Okay, welcome to live chat. Anyways, they're holding it for review. I don't know why. Whatever. Maybe I can answer it for you later there, Bonnie Rose. So yeah, where was I getting? So that was, I guess I was kind of getting on to a whole other slant of, how I got in my program, how the program kind of divvied out. When I tell people that, hey, how you doing? So how I tell people, when people don't realize my program was early on, there's 3 of them. So there was 3 in the entire country at that time. So that was that. That was a weekend program. It was Friday, Saturday, and Sunday. And that was obviously non-traditional. All the other programs in the whole country for physical therapy were all Monday through Friday. Just traditional. A lot of them are just 2 semesters, fall and spring. Mine was a trimester school, so I had to go all summer long. Even when the school was closed to everybody else, I was there. And so, plus I worked full time. Like, what? Yeah, you worked full time and did that? Yeah, I worked full time and went and got a doctorate degree full time. So, don't tell me you can't do it. It can be done if you push everything else aside. Was going through YouTube Live and you popped up. Wanted to say hello. How are you? I'm doing well. I'm doing fine. Well, thank you for coming in. And spending a few minutes for me as I go out my walk. I talked about my horror story. Um, that was an inpatient neuro horror story that I had probably 20 years ago. I always, when I do my walks, I try to tell everybody the therapy horror story that I've had. Obviously, leaving enough out so that I'm not breaking HIPAA laws. But yeah, and I'm just going over what my plans are for the next probably 3 or 4 videos, and they're all going to be kind of around the hip. Going to be the snapping hip. It's going to be arthritis of the hip. It's going to be iliotibial band syndrome of the hip, sacroiliac joint issues around the hip. Going to be able to talk about how do you tell the difference between something coming from a back problem versus a hip problem. So we'll be talking about that for a little bit. So yeah, really trying to get into the nitty gritty now of treatments at home and things that you might find symptoms that's going on with you, and like, hey, that's why. What's going on? So really, that's what I'm going into now with the channel, and obviously connecting the videos with my work. So you kind of can get some roundtable discussion about the video if they wanted to, or maybe bring up some questions. So getting another workout. So getting another workout. So yeah. So this last video really was a trifecta video of the difference between referral pain, radicular pain, and localized pain. So anyways, and all surrounding about the lower back. So hopefully that'll help it for you guys. I try and go 3 or 4 times a week. I try and go 3 or 4 times a week, and I'm trying to make a couple videos a week. And hey, Brett Worship's channel. Hey, how you doing? So yeah, this is I normally discuss that as well as I try and do at least 1 or 2 horror stories in therapy because you have a bunch of those. Or I do, anyways. You guys are out shoveling. That looks like fun. Anyways, yeah, they're shoveling. But let's get back to you guys. So yeah, so let's talk about. I had 1 horror story. Let me see if I can drum up 1 more horror story that I had. This is when I was working with some chiropractors. So this is what happened. So at that time, you really didn't get much of a meld of chiropractic and therapy. They're really separated out. You either go to a physical therapist or you go to a chiropractor. You rarely or ever would see them together. So I was working in Maryland, and yeah, there was a chiropractic clinic, and we were there at the exact same time doing physical therapy. So they would do like the spinal manipulation stuff and their little Reiki or whatever Reiki or whatever else they were doing. Maybe some meditation, and then they'd come and do physical therapy. So the horror story comes about is when a patient. All right, here's the backdrop. The backdrop is this: if someone is having a lot of nerve pain in their leg, and you've kind of surmised that it's coming from the back, you don't do a spinal manipulation. This area is already inflamed. It's already compromised. You really don't know if you're dealing with a disc that's torn, and pieces of the disc are just kind of floating around within the disc base. And so the chiropractor literally has to bring this person back out, like after their treatment session, holding, like, literally the chiropractor has the patient's arms over his shoulder, not quite a fireman's carry, Okay, but Goku fan. Yeah, that's right. Someone knows who my shirt is. So here he is. Here they are carrying them out. Okay, so they carry them out, and I'm like, what? I'm supposed to bring this person back now and do physical therapy. So obviously, we're doing some ice on the person, trying to get their symptoms to calm down. And the whole time they're there in there with me, they're just not only are they in pain, but they're just talking absolutely terrible about the chiropractor. And here I am working with this chiropractor, right? And they're just, and you can, I mean, these walls are paper thin. You can hear everything that's going on. It isn't like it's soundproof. So, so obviously, you know, we didn't do much therapy. We really just did pain management at that time. And there, and I, here's one of those times where you're like, the two professions don't meet up because physical therapy definitely would say no, that's an inappropriate treatment technique to do a spinal manipulation on someone who's got active radicular pain in their leg. So, you know, it turned out I was only there a year. So, you know, there was other horror stories, and I'll bring them up as I go along. But that's the one where you're kind of stuck. You're like, okay, you don't want to talk bad about the other profession because you work with them. You know, you're always supposed to talk people up. But then they didn't want to see this chiropractor anymore. They just wanted to do the physical therapy. And so, excuse me, it ended up being a nightmare. Because then the chiropractor's like, what did you say? I'm like, I didn't say anything. I'm just trying to get them to calm down. And they just talk bad about the whole time. And I'm like, well, what did you do to them? And I'm like, okay, well, let me tell you what physical therapy would not have done. We would not have done a spinal manipulation on someone like that. So, you know, it just, you had two butting heads of one profession thinking of something one way and another profession thinking something clearly different for the same problem and the rationale why you wouldn't do it. So that's a horror story in itself. But yeah, those are my two horror stories for tonight. Those were bad. Right at Eden High Shadow and Goku's fans. Yep. So that's the last thing you should worry about is that um, when you're treating someone, you know, worrying about what someone else in the office is thinking or doing, you know, and then you're having to try and justify what this other profession did, who you're working with. And so I would never do that again. I learned my lesson with that. You know, you know, I guess if I was ever going to do something like that again, I definitely would have to have a long sit down on, okay, what's your philosophy for these problems? What's your philosophies for those problems? And make sure that you all meet up. Because if you don't, you end up falling into those types of traps. But I was very young, naive, you know, and not knowledgeable enough about the business and the different professions, and thinking holistically at the time and thinking, oh, well, everybody does this. You know, this makes sense, right? And unfortunately, I ended up leaving the job, and you know, all things being equal, I think they're still open. You know, wasn't a bad guy. I mean, he was young too, and you know, maybe he's thinking he was going to help them out, and he just made it 10 times worse for him. And I would think, yeah, physical therapy was correct in that situation where there's a reason why you wouldn't do that because of X, Y, and Z. So, so I hope you guys are all out walking at least a couple times a week. Recommend at least, or they say what's it? Surgeon General Health says you should be walking or you should be exercising at least an hour a day. Yeah, okay. If you can get people to even just get out 3 times a week, just you know, he's thinking you need to be out there. I mean, 7 days a week. Well, that would be nice, but unfortunately, life and environment and situations happen. But and you know, you get tired or whatever, or just get out of the the monotony of having exercise. So, the whole idea is find something you like to do that's healthy for you, and it's, get your heart up and get your vascular system going, get your synovial fluid going in your spine, and hopefully you get better because of that. You can make you lose some weight. And, statistically, you live a lot longer and you live a lot healthier longer, and you're rebounding if you get ill is much quicker too. And I can attest to that 10,000 times. I have seen so many times where an elderly patient I saw who might have been in their late 70s, early 80s, and they got hospitalized for something simple as pneumonia, and they come home and they're one who actually maybe walked 4 or 5 times a week, who ate halfway decent, who drank water. They rebounded much faster. Now they're not going to rebound fast as someone who's 10 or 20 years younger than them, but they rebound way faster than someone who didn't take care of themselves, who just sits in a recliner chair and eats crap all the time at that same age level. So it's not only about the quantity of time that you're on this planet, it's about the quality of time. Do you want 10 really good years, 20 shitty years? So I think most people would probably sign up for the 10 good years. Just work at a nursing home for about 5 minutes, you'll realize it's an absolute nightmare. So you definitely don't want to do that. Anyways, but a nice statistics to sign off on is for every 1 day you're in the hospital, there's 3 days to recover. So that's kind of across the board. And we're talking about, people say, "Oh, I lost." Let's say they're in the hospital, or let's say they don't ever go to the hospital, and they get sick with COVID. Let's go ahead and talk about that for a second, and or any type of virus, and it knocks you down for 4 or 5 days. I mean, you got to think it's going to take a hearty bit of time to recover, especially if you weren't physically active before and you had comorbidities like blood pressure issues, diabetes, obesity. You might smoke and you have COPD. You might have some sort of chronic asthma. I mean, you throw 1 or 2 or 3 of those things in there, and yeah, even if you're young, you're not going to rebound at all. It's gonna knock you out for quite a while. So be very mindful of that. You gotta definitely do some sort of exercise. And then muscle training. I mean, you don't have to be some sort of massive weightlifter, but you gotta keep your muscles toned. Because I've talked about this in the past, muscles have memory. And what I mean by that is there is a certain neurological system to your muscles, without getting into depth, and what we call motor units. Okay? And each one of those little muscles has little fibers in them. Each one of those fibers, okay, has a motor unit to it. And some of those muscle fibers have multiple motor units to them. And if you train your muscles correctly, they might have a lot of motor units to them. And so you already have the hardware connected to that, and because of years of training, okay, and that's why you can rebound quicker than someone else that's never done it or did it very little, because the pathways are already there for that muscle to fire, okay, or the power to that muscle, or the nervous system, the coordination to that muscle. And that's all based literally on that type of physiology. And so let's say, I've been exercising for decades. Let's say I quit for 5 or 10 years. It's going to be very, very hard for me to rebound, but I will rebound much faster than someone that's never done that before, just because literally I have the groundwork already in my body because I trained it decades ago. we see this a lot where you see these fitness people. I think they have a couple programs out there, but you see them on YouTube where they let themselves get overweight and then all of a sudden they get skinny again. People were doing that on YouTube before they were telling people what they were doing. They were just trying to get clicks, right? I mean, you see someone who's overweight and all of a sudden 6 weeks later they're shredded. Well, what they didn't tell you is they were shredded before and they've always been shredded. So all they did was put this layer of fat on them. It might be 20, 30, 40, 50 pounds, which is a lot. But when the groundwork, when the foundation of all your muscles and the nervous system and everything, that bone structure and bone density is already been laid down for decades, because that's how you trained yourself, and then you just laid back for 6 months to gain weight. Yeah, you're gonna freaking kick off that system really quick. I mean, you're gonna burn that off quick. Not only because you have the mindset um, of consistency, because that's really what it comes down to, but also, like I said before, you already laid the foundation. I'm sorry, the wind is really blowing out here. So, anyways, I want to thank you guys all for sticking with me, and I think this weekend I gotta work this weekend, but maybe I'll start one of my hip videos. We'll see how it goes, but that's what I plan on doing this weekend, unless something else comes up. All right, y'all. Until next time, look up and keep smiling.